Hello there, this is Dr. Yatin Patel of Snooze Clinic, and I just saw a patient, of course, on Telehealth, a 62-year-old pleasant gentleman who just started using CPAP, and he's adjusting it well, but unfortunately, he's undergoing chemotherapy for colon cancer that has spread to the liver. So we talked about how to minimize chances of infections, how to clean CPAP, and we also talked about the So Clean Ozone sanitizer, our own small Snooze Clean ozone sanitizer, and of course ultraviolet sanitizer Lumin, Lumin, and few other tips on how to minimize infections while using CPAP. So if you want to learn about it, stay on. First thing I told our patient is what I've been telling my patients for last 25 plus years is nothing replaces daily mild soap and warm water cleaning of the mask, the CPAP tube, and the humidifier. So nothing beats that. He has to do that. Second thing I told him is there was a 2017 study which looked at 137 patients who were using CPAP. And the study found there was no increased incidence. There was no difference in the incidence of upper respiratory tract infections or incidence of pneumonia. Now, this patient is immunocompromised because of the chemotherapy. So he has to take extra precautions. So the next question he asked me was, should I buy an ozone sanitizer like So Clean 2 or our own affordable Snooze Clean sanitizer versus an ultraviolet sanitizer like Lumin, Lumin. So first we'll start with pros and cons of each, beginning with So Clean 2 and Snooze Clean. So the So Clean 2 is a very popular ozone sanitizer. It makes activated oxygen called ozone, which is very effective in killing bacteria. So it claims there are studies that show that 99.99% of colonies of common bacteria are killed. So not all colonies of common bacteria and not all the bacteria. And what 99.99% means is that there is a 10,000-fold reduction in number of colonies of common bacteria with ozone sanitization. So once again, not all colonies, not all bacteria, and that's the reason I tell my patients that ozone sanitization or any other sanitization should not replace your daily mild soap and warm water cleaning. It should augment it, it should supplement it, not replace it. So Clean, $300 some, effective, easy to use. It does have the cartridge that need to be replaced, the filter that need to be replaced, and has a cost associated with that. Ozone smell. In the beginning, patients complain about it, but later on, they don't. Theoretically, at higher dosage, ozone can cause asthma exacerbation. So we tell patients when the machine is running not to be in the room. ResMed has also warned that ozone itself, if it goes through the CPAP machine, can cause noise creation, and that they are saying would void the warranty of ResMed machines. I personally don't remember seeing any patient complaining about that happening. Now the big question is, does ozone kill coronavirus? Because we're in the middle of corona pandemic, and the studies in Asia in older strain of SARS virus did show some effectiveness, but we don't know whether it would kill SARS-CoV 2019 virus or not. So it's too early to say. It is effective against common bacteria. So as an adjunct, as an augmentation, as a supplement to conventional cleaning, it's an excellent choice. People couldn't afford $300 So Clean. So we did design Snooze Clean. Snooze Clean is a smaller, portable, affordable ozone sanitizer, which our patients have been using for a couple of years and have been pleased. So that's about ozone sanitizers. Next, we'll talk about ultraviolet Lumin sanitizer. So Lumin, Lumin, is an ultraviolet sanitizer that quite a few of my patients use it. The advantage is just in 5 minutes without ozone, just ultraviolet rays would sanitize the mask or the nasal cannula and the tube and the humidifier, all in just 5 minutes without danger of damage to the CPAP machine or the ozone odor. It's a little bit cheaper than So Clean 2. It does claim to kill 99% of bacteria. There are no replacement parts or filters and things like that. It does have an additional bullet. It's a small structure which you pass the tube through that, and that sterilizes the CPAP tube also. The big question, can it kill coronavirus? Probably not. Probably not. It has been shown to kill few viruses. Norovirus is one of them, but we don't know about what duration, in what wavelength of ultraviolet rays will it take for it to kill corona. So we don't know that. So that's about Lumin, ultraviolet sanitizer, and bullet. The next one is, there are some patients who ask me, Doc, can I use antibiotic wipes to wipe off the mask and the nasal cannula? Well, most manufacturers state that using antibacterial wipes may damage the mask liners or the nasal cannula lining. So that's the only objection. So you decide whether you want to do that or not. The other one, the simple one, which is my favorite, is the tube cleaner brush. That's my favorite. Just like a baby's milk bottles, that brush that moms and parents use to clean it. I strongly recommend that after the cleaning to use the tube brush to clean the inside of the CPAP tube. Patients have also been using Clean Smart spray. It's a hypochlorous acid 0.017% spray, which kills bacteria and mold spores and some viruses. We don't know about corona again. So that could be an additional adjunct. It doesn't damage, that we know, any part of the mask or the tubing or the humidifier chambers. So in conclusion, there are millions and millions of bugs in the environment. Nothing can kill all of them. Sanitizers, either ozone or ultraviolet, can augment conventional cleaning, but it cannot replace it. The other thing is replacing filter as recommended, and replacing the CPAP tubing and the CPAP interface mask or nasal cannula is very, very important from infection prevention standpoint and from the standpoint of good functioning CPAP equipment. So I've seen enough moldy, oldie supplies in my 25 plus years of career, so don't do that. And general hygiene is important. Hand washing, not touching your face, and keeping your surrounding clean is important. The big question that I come across is, a lot of the insurances do not pay for the sanitizers and cleaning supplies, which does not make sense in this day and age. And if you can pass the information on to your representative, they can appeal to the insurance companies so that they change it. Couple of other things. If you cannot afford sanitizer, please send us an email, CMAC, Certified Medical Assistant, CMA, at snoozeclinic.com, and they'll ship it to you for free if you cannot afford it. All you have to do is pledge that 1, you shall not smoke, and 2, you shall not drive drowsy. So if you cannot afford it, we will be happy to ship you our affordable portable ozone sanitizer called Snooze Clean. Just send an email to cma@snoozeclinic.com with your name, date of birth, address, and your pledge. That 1, you shall not smoke, and 2, you shall not drive drowsy. Have I missed anything? What's your experience with cleaning? You have any question for us? Please send us a comment, like, subscribe. Keeps me motivated to take time off from patient care and post videos like this. Thank you. Be safe. Wash your hands regularly. Don't touch your face. And good days are coming. Thank you. God bless you.